Being the most fatal and deadly kind of cancer known to date, lung cancer contributes to 1 in every 5 deaths globally. Recent statistics reveal that an estimated 1.59 million deaths from lung cancer per year worldwide. The following preventative measures may help reduce the risks of this lethal illness. 1. Quit smoking. Cigarette smoking greatly deteriorates the inner lining of the lungs. The inhaled cigarette smoke containing more than 70 carcinogens, cancer-causing agents, such as benzene and ethylene oxide, triggers changes in the lung tissue that give rise to tumor formation in the lungs. It has been estimated that smoking contributes to more than 90% of lung cancer cases. 2. Avoid secondhand smoke. Non-smokers exposed to environmental tobacco smoke or secondhand smoke, for instance, during passive smoking, are exposed to the same detrimental effects on respiratory health as chain smokers. Passive smoking at home, work, or public spaces increases the risk of developing lung cancer later in life by 30%. 3. Avoid exposure to radon. Radon exposure is the ranked leading environmental cause of lung cancer in non-smokers and contributes to an estimated 21,000 deaths annually. Radon, being a radioactive gas, can accumulate in homes. When it enters the respiratory tract during breathing, over time it leads to lung cancer due to its high carcinogency. 4. Limit alcohol intake. Several studies conducted have proven the close link between overconsumption of alcoholic beverages and an elevated risk of lung tumors. It is estimated that heavy drinking contributes to an overall 3.5% of cancer cases in a population, as high alcohol levels in the blood cause progression of a pre-existing tumor. 5. Avoid exposure to carcinogens such as asbestos. Limiting your exposure to cancer-causing chemicals at work, on, in public places can greatly reduce the risk for lung carcinomas, according to pulmonologists. Asbestos is a silicate mineral that may get trapped in the inner lining of the lungs, resulting in asbestos-related lung cancer. Asbestos exposure for 1 year increases lung cancer risk by 4%. 6. Exercise regularly. An analysis published by researchers in 2006 states that individuals involved in frequent moderate physical activity were 23% less likely to develop lung tumors later on in life. Moreover, exercises involving the respiratory muscles also lower the incidence of lung cancer in both men and women. Regularly practicing aerobic exercises, yoga, and jogging can immensely improve overall health of the lungs. 7. Eating healthy. According to a study published in JAMA Oncology, incorporating more fiber and yogurt in one's diet has been linked to a reduced lung cancer risk. Foods rich in antioxidants greatly decrease the risk of inflammation. Moreover, vegetables containing carotenoids such as carrots, along with citrus fruits enriched in vitamin C, help protect the body against tumors. 8. Protect yourself against HIV infection. Individuals infected with HIV have a 50% higher chance of developing lung cancer. Patients suffering from AIDS are more likely to smoke and use intravenous drugs, both of which deteriorate the lung tissue on a molecular level, further resulting in growth of cancerous cells. 9. Avoid exposure to outdoor air pollution. Hazardous carcinogens and respiratory irritants present in contaminated air lead to 2% of lung cancer cases in a population. Inhaling polluted air over long periods of time damages the DNA structure in cells lining the respiratory tract as well, leading to mutation, the causative agent of cancer growth. 10. Avoid excess intake of supplements. New research suggests that an overdose of vitamin B complex causes an early onset of lung and larynx cancer. Taking supplements excessively or without prescription raises the cancer risk by 4 times. To sum up, it is imperative to prioritize respiratory health and take improved preventative measures against lung cancer today so that we can experience thriving and healthy lungs for longer.